Welcome to Quality Pulse number 11. I am absolutely thrilled to guide you through today's explainer. We are going to jump right in, so I want you to start by picturing a scenario in your head. Just imagine two different medical laboratories. Now, on the surface, they are completely identical. They use the exact same high-tech analyzers, they buy the exact same reagents, and they even employ equally qualified staff. But despite being literal twins on paper, their actual day-to-day outcomes are night and day. One lab consistently produces highly reliable, rock-solid results, while the other is just constantly struggling. We're talking terrifying testing errors, failed audits, and dealing with angry phone calls from clinicians all day. So what exactly makes the difference here? Well, the stark contrast between our reliable lab and our struggling lab honestly has nothing to do with the technology they bought. It's not about the brand of test tubes they use. It all comes down to the presence of a robust, fully functioning quality management system. That system is literally the invisible force that separates a world-class laboratory from a genuinely dangerous one. All right, let's look at our roadmap for today. We're going to cover what ISO 15889 actually is, dive into the fascinating balance of quality versus competence, break down the 5 major requirements, walk through the total testing process, talk about how labs handle risk, and finally, look at why labs actually fail to get accredited. By the end of this explainer, you're going to know exactly what this international standard is, why it matters so much, and how it ensures safe patient results. Okay, let's start right at the foundation with Section 1. What in the world is ISO 15189 anyway? So ISO stands for the International Organization for Standardization. But here's the thing. Unlike general quality standards that could apply to, say, a car factory or a software development company, ISO 15189 is built specifically and exclusively for medical laboratories that examine patient samples. And the stakes here? They are incredibly high. The entire goal is to ensure every single result is accurate, reliable, timely, and most importantly, clinically useful. Why? Because every laboratory report influences a real clinical decision. A wrong result can lead to a misdiagnosis, a heavily delayed treatment, totally unnecessary interventions, or direct, tangible patient harm. This standard exists specifically to minimize those terrifying risks. Moving right along to Section 2, let's talk about quality versus competence. This is honestly one of the most fascinating ideas at the very core of this standard. ISO 15189 makes it super clear that laboratories absolutely need both quality and competence to succeed. Think of quality on one hand. This means having standardized systems, like those beautifully written standard operating procedures, or SOPs. But then on the other hand, we have competence. This is the human element. It's about having the actual knowledge, the intensive training, and the practical ability to perform the work correctly. Think about it for a second. A lab can have the most beautifully written SOPs in the whole world, but if the staff are poorly trained, mistakes are absolutely still going to happen. And flip that around, you could have highly experienced, brilliant staff, but if they work without standardized procedures, they might each perform tests slightly differently, leading to completely inconsistent results over time. You simply have to have both good systems and competent people to produce a reliable service. So the crucial point here is that this standard is the true absolute foundation of laboratory quality. Just look at the ripple effects it creates. For patients, it heavily improves safety by slashing those error rates. For clinicians, it dramatically increases their confidence when they're reading a lab report to make a diagnosis. For the healthcare organizations themselves, it proves a rigorous commitment to international best practices and really drives everyday efficiency. In fact, in many parts of the world, like India with NABL accreditation, ISO 1589 is the literal baseline requirement. It's not just a dusty document sitting on a shelf somewhere. It is the heartbeat of a functional lab. All right, now let's get into the mechanics of it. Section 3. We are going to break down the 2022 edition of ISO 15189 into its 5 incredibly logical, broad requirements. First up, we have the general requirements. Think of these as the absolute non-negotiables of medical practice. We are talking about strict ethical behavior, total impartiality, ironclad confidentiality, and upholding patient rights. It ensures that sensitive patient information is fiercely protected and that all testing is performed completely without bias, no matter who that patient happens to be. Next, we've got the structural requirements. These rules are all about organization and hierarchy. You see, a lab just can't function if everyone starts pointing fingers the second something goes wrong. Structural requirements dictate that roles, responsibilities, leadership, and accountability must be crystal clear. Every single person in that building needs to know exactly who is responsible for quality at any given moment. The third piece of the puzzle is resource requirements. Look, you cannot sustain quality out of thin air, right? You need qualified personnel, highly suitable and calibrated equipment, appropriate and clean facilities, and super reliable reagents. It also covers the routine maintenance of those complex machines and the ongoing rigorous competency assessments of the staff. Without these physical and human resources fully locked in, quality simply cannot happen. The fourth pillar is process requirements. This is honestly the beating heart of laboratory operations, where every single step of the testing process truly matters. It breaks down into three distinct phases. First, pre-analytical, which is everything from drawing the blood to transporting it safely. Then, analytical, which is the actual method validation and quality control during the test itself. And finally, post-analytical, ensuring the results are reported accurately and any critical values are flagged immediately to a doctor. Finally, we have the management requirements. This section ensures that quality improves continuously over time. It mandates regular internal audits, taking both corrective and preventative actions, conducting risk management, and tracking quality indicators. It's basically a guaranteed framework to make sure a lab actually learns from its mistakes instead of just repeating them endlessly. To really understand how those process requirements work in the real world, let's zoom in for Section 4, the total testing process. You see, ISO 1589 views the lab holistically. That's because quality starts long before a specimen ever hits the analyzer. Step 1 is pre-analytical. Did we actually get the right patient? Did we draw the correct sample? Was it labeled right and transported at the right temperature? Step 2 is analytical. Are our machines running internal quality controls and passing external assessments to prove they are totally precise? Step 3 is post-analytical. Are the results being reviewed, accurately reported, and rapidly communicated? The crucial takeaway here is that a laboratory result is only as reliable as the absolute weakest link in this entire chain. I mean, if you perfectly analyze a mislabeled sample, you still have a perfectly useless and frankly dangerous result. And that brings us to Section 5, a huge focus in the 2022 edition of the standard, risk and improvement. This whole section is all about shifting labs from being constantly reactive to being proactive. I want you to ask yourself these rapid-fire questions. What happens if the main reagent refrigerator just totally fails in the middle of the night? What if a whole batch of patient samples gets mislabeled by a brand new nurse? Or what if your most critical, high-volume analyzer suddenly stops working right in the middle of a severe flu outbreak? Good laboratories do not sit around waiting for these failures to happen. They anticipate them, they proactively put heavy safeguards, backup power, redundant systems, and strict protocols in place long beforehand. But how do they actually know if those safeguards are working? Well, through continual improvement and monitoring quality indicators. Quality isn't just a shiny badge you earn once and stick in a drawer somewhere. It's an active, daily state. Labs monitor metrics constantly. Things like turnaround times, sample rejection rates, equipment downtime, quality control performance, and yes, even customer complaints. By tracking these indicators, labs can investigate the root causes of issues and prove that their quality is being actively maintained every single day. So, if the rules are laid out this clearly, why do so many labs fail to get accredited? Let's transition to Section 6 and talk about the common pitfalls. A really common misconception is that accreditation is just about having the right documentation, a giant binder full of rules sitting on a shelf. But a beautifully written SOP is completely useless if it's just being used as an expensive doorstop. Assessors look for very specific, common deficiencies, things like incomplete competency assessments, poor equipment maintenance records, weak internal audits, or totally ineffective corrective actions. They don't just want to see your paperwork. They want demonstrated, tangible proof that the process consistently works out there in the real world. A lack of evidence that improvement activities are actually happening will fail a lab every single time. To summarize everything we've covered from the Quality Pulse material today, ISO 15189 is so much more than a bureaucratic checklist. It is a comprehensive, living framework covering personnel, equipment, testing, risk, and continuous improvement. It's not about passing a stressful inspection. It is about building an entire culture of trust and absolute reliability. It ensures that robust systems are in place so that every single patient receives results they can confidently rely on. I want to leave you with this one powerful thought. Because behind every laboratory report is a clinical decision, and behind every clinical decision is a patient. Quality is not just an act, it's a culture that literally saves lives. So the next time you or a loved one go in for a blood test, ask yourself, is your lab truly competent, or are they just getting lucky? Thank you so much for joining me for this explainer. If you found this breakdown of ISO 15189 valuable, please share it with your colleagues so we can keep spreading these best practices. Until next time, keep learning and keep improving.